Fedor, welcome and thank you very much.
Thank you, Max, for introducing me. Yeah, first. Okay, yes. Hi, everyone. First of all, big thanks to the organizers of this event. Thank you, Max. Thank you, Nikolina, for running this event. And today, I'm here to represent my company, Deep Longevity, which is a subsidiary of Region Pacific Group, an investment fund from Hong Kong. And the topic of my presentation will be the product side of aging clocks. Uh, First of all, a couple of words about me. I graduated in 2018. My background is in bioengineering and bioinformatics. Currently, I'm living here in Abu Dhabi. And after graduating, at first I started working for in silico medicine in the department of Biogerontology or research of aging. After that, since 2020, I started working for Deep Longevity, where I'm currently the research director. And together with In Silico Medicine and Deep Longevity, we have published and patented a number of anti-aging technologies or digital models of aging called aging clocks. And my main scientific interests are metagenomic or gut microbiome aging clocks, the psychology of aging, how we evolve our mode of thinking as we grow older, and clinical biomarkers of aging, which is really close to translational medicine. So we have heard a lot of things about aging today. We know that there are some things that make us age faster, some things that make us age slower. Yeah, so balanced diet, regular exercise, meditation, all these things make us look younger. Smoking, sedentary lifestyle, and other bad things make us look older and feel older and less energetic. But it is also good to measure things, to know how much exactly this or that thing makes you older or younger. And this is where aging clocks come into place. They allow us to define the targets, and luckily we have just had a very detailed talk about why aging clocks matter and what their function is and how to build them. And to cut long story short, Deep Longevity is living and working at the interjunction in the intersection of AI technologies and aging clocks. So we are training AI aging clocks and finding the ways to integrate them for practical use. So far, we have developed a number of aging clocks and even patented some of them. Most of these aging clocks have peer-reviewed publications, and the ones in the green or like black circles are the aging clocks that are currently available on our online platform called SenoClock, on which I will talk in a bit later. And the dashed lines mark those aging clocks that are currently being integrated into this platform. So far, we have MindAge, which is a psychological aging clock and is focused on mental aging and mental well-being. We have BloodAge, our most popular aging clock, which interprets clinical blood profiles in the context of aging. Microbiome aging clocks, which is based on stool samples and the microbial gut community. DeepMage, which is another epigenetic aging clock that we developed, and a number of other aging clocks, including ECG technologies and facial photos and transcriptomes. So to give a bit more context about our most popular aging clock called BloodAge, the first iteration of BloodAge was released in 2018 based on a study dedicated to figure out which blood biomarkers drive the aging process the most in people. And we also validated these findings in a large cohort of different populations and found out that people who are predicted older, they have a significantly larger risk of all-cause mortality. And conversely, people who are predicted to age slower, who are predicted to be younger and thus age slower, they have some kind of protective effect from all-cause mortality. This aging clock has gone through a number of iterations, and right now you can see to the right all the blood biomarkers that are required to work with this aging clock, and we have different iterations. Some of them use more biomarkers and allow you to get more detailed insights into what is driving the aging process in you. Others are more so to speak, cost-effective since they do not require that many biomarkers to be measured. And all of these aging clocks are, we validated and saw that their accuracy is practically the same. And we believe that this type of technology, not just blood age, but all the other aging clocks, can greatly benefit all the healthcare adjacent industries, such as food production, obviously clinical healthcare services, pet caring, pharmaceutical drug development, and all these other industries. Although most currently available aging clock applications are focusing on the consumer side. They are following the B2C model. And when you are dealing with B2B model, with business clients, you need to pay attention to that. Corporations, large companies or hospitals, they have quite a bit more of inertia which prevents them from using new technologies compared to consumers. And now we are actually going to start talking about our product. I will talk about the key principles that we tried to implement into our system to make it attractive to B2B clients. So our first principle is to just make it as simple as possible, to make the interaction loop with our aging clocks fit in as few steps as possible. SenoClock is basically an online service, a web service that you can log into, and then to start working with aging clocks, it is as easy as dragging and dropping the file that you want to analyze with the supported format. In this case, a blood test, which can be just a PDF slip of your patient's blood profile. You drag and drop, wait a bit, you get a pace of aging report, which highlights what is your biological age and how to reduce it. If anybody is interested in seeing a live demo, I will be available after the talk, and I will also show you a few emails that you can contact me over. This one, Fedor at Deep Longevity, is, for example, one of them. If you hit me up there, I will send you a copy of this presentation or more science-related presentations if you want. Now, one of the other key functions that is important for B2B integration of aging clocks is end-user outreach. One of the possible barriers to the integration of aging clocks for a company can be the unwillingness of the end user. In the clinical context, this is the patient who has come to the hospital to get medical help. The unwillingness of this end user to join a new ecosystem. And to prevent this blocker, we made it possible for the end user to interact with aging clocks without ever formally creating an account on SenoClock. In this case, from the viewpoint of the end user, they receive an email from their doctor, they follow a link there, and either they have an internet questionnaire that they can quickly fill in, and in this case, measure their mind age or mental well-being aging clock. Or they can already see the ready-to-read and fully processed blood age pace of aging report, because their doctor has done for them all the heavy lifting by dragging and dropping, and all the client needs to do is just open their email and see the finalized document. Another important thing is adding action items. Quite a few aging clocks which are implemented as consumer applications have static or sometimes under-detailed recommendations. In our case, we decided to make recommendations highly personalized, and this is one of the latest updates to our platform that we tried to implement Utility AI to issue recommendations to people. Utility AI is a term most commonly used in game development because Utility AI solves the problem when you have an agent And an agent can perform hundreds or maybe thousands of different actions. So you need to have an ability to score them and pick the optimal action. In our context, the agent is a patient, and the actions that then can take is a recommendation. We have created quite a flexible system which allows us to create the context, the personalization context, based on the diagnosed conditions that we detect via blood age and questionnaires on the platform, define the health profile of a person, or in other words, define which health systems are the most hurting in a person. And this context is then used as weights to modify the benefits of the recommendations, and eventually, when the reward function based on the detected issues is applied to the recommendations, we can rank them by the descending order of the score and provide a person with the recommendations that will always be relevant, because the weights and the scores depend on the highlighted medical conditions in this person. And another good consequence of using a utility AI is that when you have one database of recommendations, it doesn't really matter which aging clock you are trying to apply it to. You can recycle the same material from blood aging clock to DNA methylation aging clock to mind aging clock, because the content of the recommendation system lives in a separate module compared to the issue detection module. And now I'm at the closing part of my presentation, where I will just highlight some of the most recent features that we discovered are very important for our corporate users. The first of them is to make the platform flexible and support multiple roles, since corporations have multiple players, multiple levels of authority. You have decision makers, you have people who make payments, you have people who get to decide who actually operates the aging clocks, you have aging clock operators, and you have end users who can be, in the context of an employer application, be the employees of a large corporation who wants to make sure that their workforce is youthful and healthy. So you need to allow people to view SenoClock or the aging clock platform from different angles and enable different functions for them. Another important feature is especially useful for end users, is to enable a comparison between their own tests from different time points. The same functionality would also be essential for aging clock operators who would like to track the progress of their client across different dimensions of aging. For example, compare their mental profile and their physical health, how they progress with age. And also from the viewpoint of aging clock operators, it is, for example, if you are running some kind of a clinical trial or quasi-clinical trial and you have several groups of people, it is great to have a high-level overview of which cohort in your clinical trial is progressing faster along the aging trend line than the other. For this, you can use the dashboards that we enabled on the platform, which give you an aggregate view of how many, so to speak, cumulative years, human years, you have removed from the biological age of your total cohort. So not sure if you can clearly see these dashboards, but this is what SenoClock currently looks like. This is one of the screens that a person, an end user or an aging clock operator can see. As the end user uploads more information about themselves, they get to see all those beautiful, colorful dials and numbers. And as an aging clock operator, you can also use this information to review the health systems of your patient before you submit another request to SenoClock to produce an pace of aging report. This is one of the dashboards that can be seen when you are running some kind of as I said, clinical trial, where you can see what is the blood age deviation or the difference between your biological and chronological age across different age groups, or divided by different types of aging clocks, or by sex and gender. And you can define whichever dimensions you want to divide your data into. It can be literally cohort A and cohort B, or case and control if you're interested in that for your research project. And I guess that's it. You can contact me over this email. If you want to learn more about SenoClock, you can scan this QR code. And if you want to get this presentation, you can always contact me over this email or Fedor at deeplongevity.com. Thank you.